Good morning, all. Today we are going to see about the condition ulcerative colitis. It is a chronic inflammatory disease in the inner lining of the intestine, which leads to ulceration and bleeding in the intestinal tissue. Ulcerative colitis is a chronic inflammatory condition characterized by relapsing and remitting episodes of the inflammation in the intestine. As I said before, there is an inflammation in the layer of the mucosa. So next is the definition. It is an inflammatory bowel disease marked by the gastrointestinal mucosal inflammation due to the alteration microbiota, increased intestinal permeability and then immune system dysfunction. So here the gastrointestinal inflammation and the altered microbiota, increased intestinal permeability and immune system disinfection. This is the definition about the inflammatory bowel disease. Next we are move on the incidence and prevalence. Age is commonly in 15 to 30 years of age. People above 60 years of age at the risk of this category. And then gender, both gender are equally affected by this disease. Family history is of ulcerative colitis, and then personal habits like smoking, alcoholism is not influence the prevalence of this disease. These are about the incidence and the prevalence of the ulcerative colitis. And next we move on the etiology. In this etiology, the common is in the genetic predisposition. Environmental factors may trigger the disease like pathogens, bacterial pathogens, viral and dietary habits, and immunological imbalance or disturbance, defect in the intestinal barrier causing hypersensitive mucosa and increased permeability, and defect in the repair of mucosal injury which may develop in the chronic condition. These are the factors that may cause the ulcerative colitis. And next we are more on the clinical manifestation. The picture itself it comes to know chronic diarrhea patient have blood in stools, melena, tenesmus, abdominal pain, abnormal weight loss, and then next fever, dehydration, tachycardia, hypertension, passage of mucopurulent exudates, nostril defecation, vomiting, abdominal pain. These are the symptoms we can see in this. And next pathophysiology, already we discussed about the factors, etiological factors. This may affect the superficial mucosa colon, diffuse the immune inflammation, and then bleeding occur. So this bleeding, when the continuous bleedings, epithelium layers will be defect. So here the ulceration may form us. So continuous ulceration, the mucosas become edematous and then inflamed. The disease process usually begins with the rectum and spreads proximately involved in the colon. And so next followed by entire colon may affect. And next management, complete bed rest, IV fluid replacement, clear liquid diet for patient with a severe dehydration, excessive diarrhea. Fluid may recommended at rest and intestinal tract, restore the nitrogen balance, and treatment of anemia, iron supplementation, chronic bleeding, replacement of massive bleeding. And then next drug therapy, sulfasalazine, and then oral salicylate, and the next these are the medications. And the surgical measure, non-curative approaches, temporary loop colostomy, decompression, toxic megacolon present, subtotal colectomy. These are subtotal colectomy, ileostomy, Hartmann pouch, colectomy, and then ileorectal anastomosis. These are the surgical measures we have to follow when the patient is having ulcerative colitis. Hope you all understand about the what is ulcerative colitis and then etiology, incident, pathophysiology, clinical manifestation, and then management. Thank you for watching.